Do you ever worry that your breast pain might actually be breast cancer? Has your doctor told you it's normal, but you know a young woman on Instagram who had breast pain as her only symptom and now she's dying of breast cancer? It's confusing, right? How do you know who to believe? I get it. I'm Dr. Liz O'Riordan. I'm a breast surgeon with breast cancer, and I've seen hundreds, if not thousands, of women with breast pain. 70% of women will get breast pain in their lifetime. Today, I'm going to set the record straight. I'll tell you whether breast pain is a symptom of breast cancer, when you need to be concerned, and how to get it checked out. And if you stay until the end, I'll tell you whether your family history of breast cancer has an impact on your diagnosis of breast pain. So, let's start with a big question. Is breast pain a symptom of breast cancer? Now, if you'd asked me this before I'd had breast cancer myself, I'd have said no. Most doctors and nurses would say the same, and the large cancer websites echo this opinion. For example, Breast Cancer Now doesn't list breast pain as a symptom. Clinical guidance for breast symptom assessment in the UK doesn't consider breast pain alone to be a sign of breast cancer. In fact, I can only think of one breast cancer patient in all my years of practice who had breast pain as her only symptom. But even then, it was only seen on a mammogram. She was 41 and we found a 5mm area of DCIS that definitely wasn't causing her breast pain. But then I got breast cancer myself, and I started using social media as a patient, and I saw stories of women with breast pain who'd been diagnosed with breast cancer. The Copperfield website lists breast pain as a symptom. And so I needed to know who was right. Where is the evidence? Have I been wrong all this time? How likely is it that breast pain could be breast cancer? For every 100 women attending a breast cancer clinic, only 5 or 6 will have breast cancer. 40 will have been referred for breast pain, and for most of them, breast pain is their only symptom. No lumps, no bumps, no dimples or skin tethering, no nipple inversion, just breast pain. And out of those 40 women, the chance of one of them having breast cancer is 0.16%. To put it another way, for every 1,000 women with breast pain as their only symptom, only 4 of them will have breast cancer. And this means that 996 women with breast pain won't have breast cancer. The chance of you having breast cancer if breast pain is your only symptom is very, very, very small. Based on this evidence, NHS England has stated that if there are no other symptoms, no lumps, nipples or skin changes, breast pain alone is not a symptom of cancer and women should not be referred to an urgent cancer clinic. What does that mean for you if you've got breast pain? If you've had it for more than a month and it's your only symptom, your GP should send you to a breast clinic to be assessed, but it doesn't need to be a fast-track clinic where you were seen within 2 weeks. They can send you to a normal clinic, which might mean waiting for 6 to 8 weeks or longer. Now, I know that doesn't help you if you have breast pain, because as rare as the odds are, how does your GP know if you're one of the 4 in 1,000 who do have breast cancer? The simple answer is they don't. And that's why anyone who's had breast pain for more than a month that isn't getting better should be seen in a breast clinic. What happens in the breast clinic? So when you're seen in the clinic, you'll be examined by a trained doctor or nurse. If your examination is normal and they can't feel any lumps or bumps in your breasts, then one of 2 things will happen. If you're over 40 and you haven't had a mammogram in the last 6 months, then you'll be referred for a mammogram in the clinic at the same time. And a mammogram will pick up cancer in about 8 in 1,000 women with breast pain alone. If you're under 40, then you'll be sent home with hopefully some sensible advice and an explanation. Mammograms don't work in young women as your breasts are dense. And if there isn't a lump or a lumpy area to feel, then there is nothing to ultrasound. If the examination isn't normal, meaning that the doctor or nurse finds an area in your breast that feels different to the other side, and often it's just an area that is more lumpy, then they will arrange an ultrasound scan, which normally happens at the same time, just to make sure that there's not anything suspicious going on. And we scan everything, even if we're 99.9% certain that it's normal, just to be on the safe side. So, when should you worry about breast pain? This is really tough to answer as only you know your breasts, but as a rule of thumb, I would say it's if you meet these 3 things. It's in one breast, it's lasted longer than a month, and it's constant. So why just in one breast? Well, the commonest cause of breast pain in young women is hormonal, meaning your pain comes and goes with your menstrual cycle. We all have that time where you don't want anyone to hug you. And it's usually in both breasts, and it gets worse just before you start to bleed. It's really common, and although it can be very painful, you don't need to worry about it. If the pain is only in one breast, it could be due to something else, like a breast cyst or an infection, for example. Why do I say longer than a month? Well, hormonal breast pain and painful cysts normally last for a few days or even a week, as your levels of estrogen naturally rise and fall. Any pain that's lasted longer than one menstrual cycle and isn't getting better should be checked out. And why do I say constant pain? Well, the commonest cause of pain in one breast is actually referred pain from the muscles of your ribs and your chest wall that have the same nerve supply as your breast tissue. You normally feel this around the edge and the bottom of the breast. And if you lie on your side and press your chest wall, it's often the muscles that are normally sore, not the breast tissue. And this is really common. Sometimes it's due to a badly fitting bra. We don't know why some women get it and others don't, and why it suddenly appears. And I'll be doing a separate video all on breast pain soon. Normally this pain comes and goes during the day and lasts for a few weeks or even months. But if you have pain in one breast that is constant and doesn't come and go during the day or the night, and it does last for longer than a month, then you should get it checked out just in case. Now, if you found this video useful, remember to subscribe so you don't miss my next one. So, on to the bonus section. Does a family history of breast cancer mean that your breast pain could be breast cancer? Many women are rightly concerned that their breast pain could be cancer because their mum or their aunt or their granny had it. And if that's you, I can only imagine how anxious you must be feeling. But let me put your mind at ease. If there's only one person in your family who's had breast cancer and they were over the age of 45, then you are not at any increased risk of getting breast cancer yourself. If you are worried about your family history of breast cancer, then your GP can refer you to a family history clinic where we will properly look at all your family history and tell you your personal risk. That's it for me today. Let me know in the comments if this was helpful. I'm Dr. Liz O'Riordan, and thanks for watching my channel.